Hi everyone, my name is Khu Jia Qi and today I will be presenting my topic which is medicalization of deviance. So this topic explores how certain behaviors that society once viewed as bad or immoral are now understood as medical or psychological problems. Let us begin my introduction of this topic. So the definition of social deviance is any behavior that a society finds offensive. So for the second definition, which is medicalization, it means the act of considering something to be a medical problem or representing it as a medical problem. And then the third one is medicalization deviance. It means the process of redefining behaviors traditionally seen as deviant, such as addiction or mental illness, as medical issues that require treatment rather than moral or legal punishment. So let's begin with some key theories who shape this concept. So the first one, which is Michael Foucault. So Michael viewed as a key example of how modern power operates through discipline and normalization rather than overt force. So he argued that modern societies don't control people through violence, but through normalization, meaning institutions quietly shape what is considered normal or healthy. So when we label a behavior as sick, we shift social problems into medical problems. So the next one, which is Irving Zola, who also shaped this concept. So Irving Zola argued that medicine acts as an institution of social control by making health and illness labels relevant to an increasing part of the human life. He believed this process appears to leave moral responsibility from the individual but ultimately does not, while also depoliticizing social problems. So, the last one who shaped this concept is Peter Conrad. So Peter introduced the idea of the medicalization of society. He described medicalization as the process of redefining behavior as a medical problem, mandating the medical profession to provide treatment. He showed how behaviors such as hyperactivity were transformed into medical conditions like hyperkinesis, which is ADHD. His work highlights how medicine influences how we understand human behavior today. Explain about the process of medicalization. So, medicalization usually happens in three steps. So the first step is identifying behavior. So how can we identify behavior? So the first one is this includes anything considered unusual or problematic, such as addiction, depression, ADHD, or abnormal sexual behavior. So after we identify behavior, so the next step is classified as a medical or psychiatric disorder. So in this step involves diagnosis, clinical labels, and medical monitoring. So the last step which is provide treatment, medication, or therapy. This may include medication, therapy, rehabilitation, or hospitalization. So once behavior enters the medical system, it becomes something to be treated instead of punished. So what is the positive effects of positive deviance approach in healthcare? So the first one, which is access to treatment and therapy. People are no longer blamed or punished when they receive counseling, medication, and emotional support. So the second of positive effects are error reduction. Through this diagnosis, treatment, and rehabilitation, individuals can correct problematic behaviors themselves and lower the likelihood of future deviance. The medicalization reframes these behaviors as health issues, and it can reduce societal misjudgments or unfair treatment. Instead of judging people as bad, medicalization helps identify underlying problems like trauma or chemical imbalance. So the third one is cost savings and life saves. Rehabilitation reduces repeat offenses, which means less cost for prisons and law enforcement. So if got the early treatment also prevents long-term harm, to individual and society. Medicalization can prevent harm to the individual and society by addressing underlying health or behavioral problems early. Now let's look at some real-world cases. So for the global example, many countries treat drug addiction using methadone clinics. So this shows a shift from punishment to medical treatment, and there's also global evidence of rising use of psychotropic medications such as antidepressants and antipsychotics, which is showing the trend of medicalization worldwide. For the Malaysia, after COVID-19, Malaysia experienced a major increase in mental health services. A study of adults in a forensic mental hospital shows that individuals with ADHD often had other conditions like substance dependence or depression. They also tended to commit offenses at a younger age. So this highlights the connection between untreated medical conditions and deviant behavior. For the conclusion of my topic, medicalization is more than medical treatment, and it is a modern form of social control. So, society must be aware of how medical power shapes norms and behaviors. Not all deviance is a disease, but sometimes it reflects human diversity or social problems. So by understanding medicalization, we can better balance between offering help and avoiding unnecessary laboring. So in my topic, I would like to end with a quote from the slide, which is in modern society, doctors have become the new moral judges. Here is my question. Should everyone unusual behavior be treated medically, or are some simply natural human differences that we should accept? In my opinion, not every unusual behavior needs medical treatment. Some behaviors are just natural human differences that make people unique. So we should only use medical intervention when the behavior causes real harm or serious difficulty. Otherwise, society should accept and respect these differences instead of turning them into disorders. So that's all of my presentation. Thank you for listening.